Talking to you today about poison control and how to prevent poisoning and what to do if someone unfortunately gets poisoned at home. Poison control is a very common topic. We see a lot in the primary care setting. One thing we can do to prevent poisonings is to lock up your medicines, to keep them up high, safe, where children can't reach them, or sometimes adults can't reach them, especially if they're medications that we use for pain control or for anxiety. Other things to keep in mind is obviously to keep all detergents and dish soaps and other types of liquid chemicals up high and never to mix them, and oftentimes to keep them clearly labeled. Kids sometimes mistake these types of chemicals as their colors are quite welcoming, like light blue or light yellow or red, and they want to swallow them because they look good. Oftentimes we run into that with children's medicine or adult medicines as well, because these pills look good or look interesting, they look like candy, and kids oftentimes want to take them. So that's why we really have to lock up our medications and keep our chemicals away from children. If there is a child or an adult that you do find an accidental poisoning or accidental overdose, the most important thing is to assess whether they're having problems breathing or whether they're conscious. If they're having any issues whatsoever that you're nervous about taking care of, please call 911 right away. Otherwise, most poisonings can be managed at home. What you need to do is make sure the person is stable, and then call poison control, which is very helpful. Poisonings or accidental ingestions are very common. We need to do everything we can to prevent them, and if unfortunately it does happen, please call 911 if it's an emergency. Otherwise, call poison control, as they will be very helpful and they'll direct you what to do.